Namaskar. Today we are going to talk about timeline of IVF. So, how do you set the timeline of IVF? Now, suppose you have already planned for pregnancy and you're getting pregnant for more than 1 year. You have already visited few doctors and you have been advised for IVF. Now, the first has to start with choosing the right IVF center. So, the timeline starts from choosing the right doctor and the center. Once you've chosen, you visit the doctor with all your earlier reports, and the doctor will now streamline your IVF according to your convenience. I always prefer the patient should make their plans of IVF once they are all relaxed, and it should not be in just like you have to just hurry up with something. So try to relax yourself, set your own timelines. If you're busy with something, just first set those priority and then set your time limit for the IVF. Now, once you have chosen the right time, the doctor will help you plan your IVF cycle, because she has to start the stimulation from second day of your periods. So, all your tests will be done beforehand. Your all thyroid levels, prolactin levels and blood levels will be checked, as everything should be normal. Now, once your day 2 comes, this doctor will start with ultrasound and some blood tests to see all the hormone levels are okay, and then your injections will be started. These injections for around 10 days to 11 days depending on your eggs growth, and once the eggs are ready by 18 to 20 mm within the period of 10 to 11 days, the last injection, which is called trigger injection, is given, and an egg retrieval process is planned after 35 hours or less than 36 hours of the trigger. Now that pickup is done under anesthesia. The IVF doctor will do the pickup under anesthesia, and that is a daycare surgery, and you'll be sent home. After that pickup, if the doctor is planning for a fresh embryo transfer, she will schedule you for an embryo transfer date after the pickup only. Now if she is planning for a blastocyst transfer, she may call you after 5 days. If she is planning for a day 3 transfer, she may call you after 3 days. But mostly, as now I am following, we are only doing frozen embryo transfers. So we schedule your cycle as if that you will again get a period after say 10 or 11 days. Now for a frozen embryo transfer, we start giving you certain oral medicines again from the second day of the next menstrual cycle, and that with those oral medicines we prepare your endometrium, and then after say 10 to 11 days, when the endometrium is ready more than 8 mm, again some injections are started and an embryo transfer date is set. Now this embryo transfer is without anesthesia. It is again a daycare surgery. So if you total ask me, from the pickup to embryo transfer or frozen embryo transfer will take around 1.5 months. So I think this should be the earliest will help you out, and after 14 days of the embryo transfer you will get the result. So although fresh embryo transfer cycles will be finished in 1 month, but with the result, a frozen embryo transfer cycle may need 1.5 to 2 months. But this time limit is very relaxing, and you should plan your cycle accordingly. Let's not hurry up, and let's not be in fast pace that okay, we'll do a transfer now and then the baby. Let the doctor decide when is the right time to do an embryo transfer. And for more such queries, please let us know. Thank you so much.